Assalamu alaikum everyone. Welcome to IMIC Live. Uh, this is Farzana Wali Liza, Chairman International Medical Information Center IMIC. আপনারা জানেন 4th of February ওয়ার্ল্ড ক্যান্সার ডে ছিল। তারই ধারাবাহিকতায় আজকে আমরা ক্যান্সার বিষয়ক ডিসকাশন নিয়ে আসছি। আমাদের আজকের বিষয় হচ্ছে ব্রেস্ট ক্যান্সার অ্যাওয়ারনেস। So in 2020, almost 2.3 million women diagnosed with breast cancer, and there were globally more than 6 lakh patients actually died. So South Asian countries are facing this disease more because of the lack of breast cancer awareness and inadequate access to healthcare. And most patients are diagnosed at an advanced stage of the disease. Early detection has a crucial impact on overall treatment outcomes. To battle against breast cancer, recognizing the importance and impact on women's quality of life and well-being, International Medical Information Center IMIC Bangladesh and ACG Oncology India jointly organized this webinar on breast cancer awareness. Please join our live at and comment. Please put your all your comments and queries through this live. Thanks everyone for joining us. So let's get introduced with our today's session panel speaker, Dr. Kritika Murugan. Welcome to our show.
Thank you.
So Dr. Murugan is Kritika is an experienced oncosurgeon with a special in breast and oncoplastic surgery, performed more than 8,000 oncosurgeries so far within 15 years of experiences. She has completed her fellowship training in breast and oncoplastic surgery from the Royal College of Surgeons, England. She has also received fellowship training in colorectal surgery from Edinburgh, UK. She also has robotic surgery certification from Newcastle and completed her laparoscopic fellowship training from MHTU Guildford. So many experiences you have. So it's a pleasure to have you to our program. I think the audiences will be benefited with our today's discussion.
I hope so as well. Thank you very much for that introduction. Thank you.
Thank you. So before going through with all this discussion, let's have a virtual tour with the Healthcare Global Cancer Center, ACG, India.
Cancer can strike anyone, anywhere and at any age. In India, there are close to 1 million cases every year. Every known type of cancer involves an uncontrolled growth of malignant or cancer cells in a particular area of the human body. There is a need for accessible world-class cancer care with the best possible technology and expertise. Bangalore was the first destination for this. HCG was launched in 2006 and since then has grown to become India's only dedicated cancer care network. HCG's comprehensive cancer care network is known as a Center for Innovation and Advanced Technology. HCG has a long list of achievements and firsts that has transformed cancer care in India. Asia's first bloodless bone marrow transplant. India's first computer-assisted tumor navigation surgery, CATS. India's first hospital to introduce flattening-free filter, FFF mode technology to treat a patient. Asia's first center to have treated a patient with 3D radio-guided surgery, known as Surgikai. India's first center to introduce biological reconstruction to treat bone cancer. Today we touch the lives of many around the world. And what puts us ahead of others is accessibility. Each of our centers are known for the many benchmarks they set in the world of healthcare. HCG Bangalore, the first privately owned comprehensive cancer care center in Karnataka, is acquired by HCG. First private center in the country to introduce cyclotron and PET-CT technologies. HCG Delhi, first center to introduce IGRT technology to North India. HCG Nasik, first private comprehensive cancer care center in northern Maharashtra. HCG Ranchi, first comprehensive cancer care center in Jharkhand. HCG Hubli, first center in North Karnataka to introduce IGRT technology. HCG Vijayawada, the first comprehensive cancer care center in coastal Andhra Pradesh. HCG Bangalore, one of the first centers to introduce cyberknife technology to cancer care. HCG Ahmedabad, first privately owned comprehensive cancer care center in Gujarat. First center in India to introduce TrueBeam technology. HCG Chennai, first center to use the revolutionary FFF technology to treat a patient. HCG Cuttack, first comprehensive radiation oncology center in Odisha. HCG Mumbai, first comprehensive cancer care center of HCG in Mumbai in partnership with B&H, which will have the first advanced and versatile radiation therapy center. HCG MSR Bangalore. Today we are proud to introduce a new cancer fighting technology for the first time in India with the launch of Agility Synergy at HCG MSR Cancer Center. The HCG MSR Cancer Center is a partnership between two well-known medical institutions, HCG and the MS Ramaya Medical Group. Today, with the addition of Agility Synergy, HCG has set a new benchmark in the field of cancer care. With 475 oncologists and a network spanning 27 centers globally, HCG provides hope to countless patients every year. HCG, the specialist in cancer care.
Well, it's a really great tour with SCG, and it's a honor for IMIC that IMIC is working for SCG, highly esteemed cancer care hospital for the patients who need advanced treatment management, and you doctors are the hope for our patients. So let's discuss on today's topic on breast cancer awareness. Would you please, doctor, over to you, please.
Thank you very much. That was a very, very kind introduction. Let me start off by showing you a small presentation. Now, this presentation is only to set off a dialogue between us. I'd be happy to make it as interactive as possible. There may be a bit of a language barrier. I remember presenting before this and having a bit of a language barrier. There were people, I had spoken both in Hindi and English. So
No
whatever we
problem.
can do to help, that would be lovely.
No
Can you
problem.
see my screen at all?
Uh,
Can you see my screen?
yes, please.
So I'm Kritika, like Madam just said, I'm one of the surgeons based at HCG Bangalore. Why are we even talking about breast cancer? Like we know, it's the most common cancer affecting women in the whole of Southeast Asian region. in their lifetime, about 1 in 12 women will be affected with breast cancer. That number is supposed to come down quite a bit. So 1 in 8 may be affected with breast cancer. This is similar to what is happening in the West. A few years ago, a lot of women were dying of breast cancer, up until 2013, I would say. What has changed now in our favor is that the survival rates are so much better. And that is a combination of factors, including better treatment modalities, women present early investigations, which have been upped. So, all leading to better treatment outcomes. And therefore, as a result, I think we can reduce the number of deaths secondary to this cancer. Whenever I'm sitting in the clinic, one constant question that I get asked is, what is the cause of breast cancer, doctor? If there was one cause which would zero down as to why a woman got breast cancer, I think I would win the Nobel Prize. Unfortunately, we don't have one particular cause. We know that there is a change in the gene. What causes the change in the gene is a combination of factors. There are some which are under our control, some which are not under our control. Things which are under our control is a lot of environmental and lifestyle related factors. But there are some which are not. As we age, we are more prone to cancer simply because the death of the cells is higher and the repair mechanism takes a beating. So as we age, and now with life expectancy increasing, the chances of cancer is also more, and also it is said that it's going to be a chronic disease like, say, diabetes or high blood pressure or heart problems. So it's one of those things which is likely to be an epidemic, if not a pandemic. A family history, people do ask me a lot, but I don't think there's too much to worry about this, because what comes through the families is only about 4 to 5%. Race, I don't think we should harp too much on the Caucasian race, because those days are gone now. The Asian and the Southeast Asian population is fast catching up. Early menarche, late menopause, postponing the birth of children, all these seem to play a role. But why a particular individual is prone to it and not others who do exactly the same is a question, which is $1 million question. Some things which we can control, like I said, cancer is being classed as lifestyle disease. So a lot of it is about our lifestyle. We all know that BMIs are increasing. Our waist sizes have increased quite a bit. In fact, obesity is the norm now. What was about 10 years ago a size 12, accepted as size 12. Now, according to marketing companies, they've increased that size to a size 14. So everything is kind of caught up on the same lines. Obesity in children is a huge problem as well. The amount of exercise we do, probably more of a sedentary activity. Madam herself has been in till about 7 o'clock today, and she's telling me she's had a hard day. But the amount of exercise that we actually fit in is very, very small. WHO recommends that we do about 20 to 30 minutes of exercise every day for at least 5 to 6 times a week. Breastfeeding is supposed to be protective, but not absolutely so, because most of the Southeast Asian women tend to breastfeed. They say the longer you breastfeed, the better is the chance of protection. And the protection seems to increase if it's more than 2 years or so. Limit the amount of alcohol and smoking. Smoking is supposed to be the new sitting, basically. Sitting and smoking kind of go hand in hand. Hormone replacement therapy, though I think now we have so many advances that they have just estrogen-only based pills or progesterone-only based pills. So we can't kind of say that this will definitely... HRT has taken a very bad beating. It has to be in a very measured way. These are factors which are under our control. What are the common signs and symptoms a woman comes with? Lump is something which everybody knows about. If there is a lump in the breast and therefore they come in. But having said that, I must say not every lump is cancerous. So have your lump investigated. Nipple discharge, especially the ones which are green or brown in color, need to be viewed with caution. Change in the size or contours of the breast. It could be an abnormal shape of the breast. You notice that my breast was quite pert looking a few years ago. With age, the breasts do tend to sag. But any abnormality out of the normal that you notice, please seek the advice of a specialist. Nipple inversion, especially in people who've had pert nipples, and then it starts to go inwards, could be a sign of something sinister going on. In fact, there was a lady who presented to my clinic who didn't have any lumps. We couldn't feel anything at all. The only sign that she presented with was inversion of the nipple. And sure enough, when we did a sonomammogram, it picked up some microcalcification. When we biopsied that, it turned out to be DCIS with a small bit of invasive cancer. So these things are quite common, more common than we imagine it to be. Crusting around the nipple areola complex, it is like eczema. It peels off, scabs again, starts to bleed, dries, and becomes a recurring process. In those cases, you need to get it investigated for what's called Paget's disease. Now, this one, most of them are aware of a peardy orange appearance, which is the orange peel appearance of the breast skin. It's quite suggestive of an inflammatory breast cancer. It's quite an aggressive disease, and you wouldn't want people coming to you at that stage. Now, why do we talk so much about awareness programs and come early? It's simply because early detection is equal to cure. I keep telling women that the power lies in your hands. What you can do is a self-breast examination using the palms of your finger. Now, there's a little video right at the end where I'm showing you a self-breast examination. Even if you don't take anything from this talk, if you can learn to self-breast examination and do it routinely, religiously, for women who have their periods once a month, a week after your periods, that's when the breast is the softest. For people who have finished their periods or have attained menopause, just choose one particular date of a month and routinely examine yourself on that particular date. Whenever you come to us, the test that we do a sonomammogram where there's an X-ray and an ultrasound. If there is anything suspicious, we obviously do a biopsy and get a lot of information from it. The treatment of breast cancer is multidisciplinary. All our statistics tell us that the more multidisciplinary teams that are involved in the care of cancer, the better is the outcome. In our HCT, we have a breast MDT every Thursday. It's not just for breast. We have it for head and neck, for pediatrics, for bone, for hematological malignancy. So you have it for there are verticals. So breast happens every Thursday. You're more than welcome to discuss your cases if at all you need to. And now with the virtual world and the technology being so advanced, you can connect to any corner of the world. We go to the patient's house, like they say. We even connect with patients in their bedrooms and tell them what our esteemed team of doctors have thought of. It's a combination of surgeons, radiation oncologists, chemotherapy, medical oncologists. This may be combined with hormone treatment, may not be removal of ovaries. There is a lot of emphasis on personalized medicine and genomics now. Every part of your gene is studied, and we tend to find out, one, the cause behind the cancer and the treatment for it as well. So, and each one has a different personalized plan which is drawn up. Everyone may not, one size doesn't fit all. That is the key. Breast conservation therapy has taken off in a big way. I know a lot of people in Bangladesh still have mastectomies. I would like to say that breast cancer programs, about 10 years ago, even in India, probably the mastectomy rates were quite high. But then with all the advances in science and medical oncology and radiation oncology, breast conserving surgery is the norm these days. I've just put the picture of Angelina Jolie up because she served as a brand ambassador for raising awareness about breast cancer. Even if people don't know much about genomics in cancer, they know about the BRCA gene, which is brilliant. And thanks to her for that. I think it's all a part of the awareness campaign. Surgery, we mostly tend to do breast conservation surgery. Most of the times we are able to save the breast. We do what's called sentinel lymph node biopsy, where 1 or 2 lymph nodes are tested. We don't take out all the lymph nodes from under the armpit. It reduces your risk of lymphedema, which is arm swelling. We also try and recreate the breast or reshape the breast so you don't have problems with cosmesis. After the surgery, you wouldn't be able to make out where the scar is. The women tend to forget about what they've undergone. These are some of our pictures of breast conservation surgery. You can see, you can hardly notice a scar. This is a reconstruction that the woman underwent from a muscle from the back. Sentinel biopsies can be done either with methylene blue or with a specialized gamma probe. I use the gamma probe personally. There are surgeons who use methylene blue as well. This was a lady who came to me, a 32-year-old chartered accountant from a very well-to-do family. And the reason she came was because her husband said he couldn't take the stench anymore. She died within 6 months of diagnosis. We still have people like this coming in today's day and age. We do not want to be there. We want to be finding it out at a stage where it's much before it's actually become a lump, because early is equal to. I would just like to show you a little video on self-breast examination before we start to take questions. I wonder if you can see my screen. Can you see my screen?
Yes, we can see it.
Carcinoma or breast cancer is the most commonly occurring cancer in middle-aged women. The breasts are specialized accessory glands of the skin, consisting of ducts embedded in fatty tissue. Breast cancer can arise in the duct system anywhere from the nipple to the terminal lobule. Most often, the cancer is detected after it has spread to other parts of the body. Periodic breast self-exams are essential for early identification and treatment. The breast self-exam should be done regularly, every month immediately following the menstrual cycle. Step 1. Visual inspection. Look for any changes in the skin over the breast, like redness, swelling, or puckering, and
this is a self-explanatory video, so there are 3 parts to it and they explain each one in detail. I'm not going to be talking about it, but even if you can absorb the visuals, I would be ever so grateful.
Changes like discharge, scaling, or indentation. Step 2. Tactile inspection. There are 3 ways to physically examine the breasts. The circle method. Move the 3 middle fingers in a circular fashion starting from the outer edge of the breast towards the nipple. The line method. Move the 3 middle fingers starting from the underarm area down below the breast. Move slowly back upwards, repeating this until the entire breast is felt. Wedge method. Move the 3 middle fingers, beginning at the outer edge, towards the nipple. Repeat the procedure for every wedge until the entire breast is felt. Regardless of the method, the objective is to feel the entire breast and observe any abnormal changes. The breast should be soft and smooth to the touch. Pay special attention to check the underarm and upper chest areas.
Always finish by examining your armpits. That's an important key point to take home. Yeah, so that's that. Thank you very much. I hope that presentation was useful.
Thank you so much, doctor. I mean, that is a lot of information, and to our audiences or the patients, it's not that we'll have to create awareness between the women or the female members of our family. It's really important that the male members of our family also get aware of this disease and gets her wife or family members, female members, get screened. So, what age usually? From what age you usually prefer that the patients go for the clinical examination screening, not only just examining herself?
Absolutely, ma'am. Spot on. A lot of women are the ones who are the decision makers in the family. So, very, very well said. I think men need to understand the breast cancer bit as much as a woman needs to. Because most of the times it is them who are bringing them to the doctor, or the woman has told the man, and only then they come. Most of the women do not tend to come on their own, especially in the Indian or the Southeast Asian setup. Now, what age would I recommend? It's a very, very interesting question, because if you look at the West, they'll tell you about a 40 and above is the time when you should be coming for screening. I don't think that is the case in our population. We are affected at least 10 years, a decade before the Western population. Our peak age seems to be in the age group of 30 to 40. In fact, in our clinic last week, most of the women who came were between the age of 20 to 30. Now, how do you tell them that have your examination at 40? Because by that time, the disease is probably advanced and gone everywhere.
That's what I'm just asking, because the young patients are more now we can see for, in fact, they're already in the advanced stages. So
So
this is
what
really
I
important
usually
for us
tell
to
my
understand.
what I usually tell my patients is once the girl has attained menarche, teach her self-breast examination. Teach her what is normal for her and what is not normal. So 12, 13, 14, they should know what their normal breast is, what is normal for them and what is not, and continue it for the rest of their life, because that is the biggest service that they can do for themselves. If you're talking about screening, if there is a strong family history, I generally advise that come at least 5 years before the age of the affected member. If somebody was affected at say 35, start coming at 30 or as early as you can. If there is no family history, generally once they've attained menarche, I usually say self-breast examination. Any sort of doubt, seek the help of a specialist. That is my general advice, because I've seen it in women as girls as young as 13 whose breasts haven't developed yet. So that is a bit disheartening more than anything else. So I don't think there is a right age, especially in the Asian population. I think it's important to start examining as soon as you can. Teach them as early as you can.
And I think it should be in our education system, uh, for our younger patients to get to know more about breast cancer. It's really important right now to actually create this awareness through the education system as well. It's not that we will discuss, we'll tell people, and eventually people will be get aware of. So, considering all these things, we know that ACG is really good for genetic testing, and they have their own lab, molecular lab testing facilities is there. So, can you please a little bit discuss on the genetic testing, because or genomic testing, so how it helps a patient to get treated or find a good appropriate treatment option, please.
Genomics basically will tell you the chances of anything being transmitted through your genes. If there are any mutations in your genes, with respect to breast cancer, we do what's called somatic and the variety of testing. Now, in this, basically what happens is either you test the tissues of the patient who's got breast cancer, or you test their saliva if they've come for a generalized screening. Based on that, we try and see if there are any mutations which have come from the family, or if the patient has developed a mutation within his body which make them more prone to a particular kind of cancer. It's a 500 gene panel that we do. The genomics department is headed by Dr. Mitwa Ghosh, who's done excellent work with genomics and just raising awareness about genomics. I think the whole world is going that way. It's an era of personalized medicine, and each one we need to understand what the genes are saying to us. What are they trying to tell us, which would help in the treatment? So that needs to be the way we're going. So people probably know a little bit about BRCA, BRCA1 and 2, where they think there is a risk of breast cancer, ovarian cancer, peritoneal cancers, or prostate cancers in men. But I think there are more than that. In our population, we've seen a high incidence of PIK3 mutation, which seems to increase their risk of breast cancer. There are some genes which are transmitted, will which will lead to the point that you're not actually responsive to hormones, though you're a hormone positive tumor. All these things, it's studying the cancer in its entirety and detail. And that will help with the treatment immensely. In fact, I think that will become the norm in a few years. How we have ER, PR, HER2, Ki67 these days. About 10 years back, we wouldn't have even spoken about it. I think genomics will become the norm in the next few years, I think.
Yeah, absolutely. Recently, we have, few of our patients who actually aged patients. So, considering that their age, actually, they scares of the surgical procedure and all these things. So, what to expect from the surgical procedure, and what are the actually physical criteria you consider before going for the surgery?
Okay. By aged, what do you mean, ma'am? How old are we looking? What sort of age are we
Like
looking?
after 65 or 60 years old. In fact, I also want to share with you another experience that a patient was suffering from uterus cancer. She was treated with chemotherapy and everything, but suddenly she again diagnosed with the breast cancer later on. So then the local doctors advised that okay, you are not fit to go for the another surgery, rather go for radiation, and after shrinking you can go for the surgery. So how you actually treat this kind of patients?
Ma'am, 60 is not old. My dad is 60 and he's more active than I am. A lot of older people whom we say are old are actually physiologically quite strong. So I wouldn't call 60 old. 60 is the new 40 is what they're saying, as the age expectancy has increased as well. So 60
Yeah.
should not be the cut-off criteria. What I would say is before surgery, we run them through an anesthetic checkup, ma'am.
Yeah.
Most of the breast cancer surgeries, we do it as a daycare procedure. So usually you come in the morning and go home in the evening. From the
Yeah.
very next day, you're able to start most of your normal activities. You're not bed bound. You can get on with your eating, cooking, cleaning, and all the rest of it. Whatever. The only thing we say is do your arm exercises or physiotherapy as suggested by your clinician. That is the only thing we say. Otherwise, it is not limiting in any way. But then you go through an anesthetic checkup where you have a series of blood tests, an ECG, echo, and whatever is necessary to make sure you're fit for the anesthesia. That's the only thing that we do for the patient. There are patients who are 90 and above whom we have operated on. So just because somebody is 90 doesn't mean that is it. We are not going to be. They are assessed in a particular way, and there is a team for it. Right? So
Mhm.
based on that, we decide whether they're suitable for surgery or not. And I think that's the way
Yeah.
you have to.
Yeah, that's actually for any kind of surgery. Patients gets really scared of all this procedure. But what should be your advices for the family member when any patient diagnosed with the cancer, because to cope up with this situation and all the treatment protocol, they it's not that only patient is facing, the whole family is facing. So if
Correct.
you kindly I mean inform anything that they can be encouraged how to deal with the cancer patient, how they can motivate the patient to get this whole lot of treatment procedure, please.
Very, very well said, ma'am. Because I think fear is your biggest enemy, isn't it? Most of them don't tend to come because they're scared that somebody's going to tell them it's cancer. It's a big C that they are scared of. Now, of course, the bigger C is COVID. I think that's probably shaken people quite a bit. Cancer has taken a back seat, I think. But I think it all lies in your mind. People make it out to be a battle. It's like, it's corruption, or it's such a bad thing. Actually, it's not. The treatment is a process. You go through the whole thing. I don't think we should be talking about survivors battle and words, like it just blows it out of proportion. I think two things which are very, very important is, one is courage, come out of the fear bit of it, and the second one is the positive attitude and the belief that you're going to be fine. I think these two things make a big deal of difference. In our societies, we are quite supported by families. It's a good thing in certain ways, because the families push you through. There's so much positivity. You're not loneliness and all that. Probably the developed world country problems are not that common here yet. But at the same time, you will have a lot of family members giving you 10,000 different opinions. One saying, I know a
Yeah,
person who had this, who
exactly.
died because they were given this, or chemotherapy will do all this to you. So it's all blown out of proportion. I think each one is different, and each patient's case has to be addressed differently. You have to look at it in extreme detail, and nitty gritties of it have to be understood, and then you're able to treat it better. From the patient side or the family side, what they need is a lot of mental strength, I think, positive attitude, and the belief that you're going to be fine. Getting rid of the fear is half the battle won. If at all it's a battle. I do not think it's a battle.
Absolutely. And we have lots of success stories. People are doing good, like you given an example of Dr. Angelina Jolie. So, yeah, so these are the examples we have already. So, we should be inspired. But before getting through this, we should be aware that we should not face this disease. We should raise our awareness and create awareness. So we got a question from our audience that does a family history of breast cancer put someone at a high risk? That's naturally yes, but if you can brief on this,
Only
already you
about
said.
food. Actually, it's not necessary that somebody has had cancer in your family doesn't mean you will definitely get it, and it's not the other way around as well. Because there's nobody in the family who's got it doesn't mean you will not get it. The chance of any cancer of breast cancer being transmitted in families is about 4 to 5%. That's a very small percentage. The BRCA gene, especially transmitted in the family, is a very small percentage. But yes, it is slightly higher than the general population. That's the only thing we would say. There's another question which says, is there a link between hormone replacement therapy and breast cancer? I did touch across this previously. Now, HRT has got a lot of flack. A lot of them said HRT will increase your risk of breast cancer. It's a very, very, very small percentage. I think the problems that you get from menopause or low estrogen levels are much more than the risks of HRT causing breast cancer. And now you have specific hormone replacement therapies where it's just the estrogen or adding testosterone. It's a balance between this and the other. So I don't think taking HRT doesn't mean you will get breast cancer. A slight, very tiny risk. That's all I would say. If you have symptoms of menopause and you need HRT, you need HRT, but you just need to screen yourself a little more than often. That's it. What are the holistic?
Yeah, the patient maybe wanted to know the treatment options you have from ACG hospital.
It's an MDT approach, like I said, so it's a multidisciplinary one. You will get everybody on board. It's a dedicated cancer setup. There's nothing else which goes on here. So you'll have surgery, medical oncology, radiation oncology, psycho-oncology, which addresses the psychosocial needs of the patient,
Absolutely.
nutrition and dietetics, physiotherapy, all of them under one umbrella, genomics, genetic counseling, all of it. It's a comprehensive cancer care setup. So yes, it is definitely holistic.
Yeah. So I mean we already discussed on the maximum of the things. So just if you kindly brief on the nutrition, what are the nutrition can help us to get rid of this, or any vitamin supplement, or our health I mean exercises. Already you emphasized on this, but the last part we want to discuss on this, please.
Okay. See, nutrition is a very complex science. It's not about eating just fresh fruits and vegetables or going on a diet. Going on a diet doesn't mean anything. It just means that your diet has to be healthy. Everything in moderation is what I say. I'm not a big believer of multivitamins and supplements and all the rest of it. I feel what goes in through your mouth into your stomach is best absorbed. So you have a team of nutrition and dietetics who look at your BMI, assess your body mass index, the muscle mass, and they advocate a diet for you based on how much carbohydrates you need, what are the sources. And it's all catering to the kind of diet we actually have, the kind of food that we normally eat. And it's not something exotic like you have to eat this particular blueberry, which is not even available in the continent. No, it's all tailor made to that particular person. So they will usually draw up a diet chart, ask them what they normally eat, say poha in the morning or chapatis in the morning, and then they try and tell them what else needs to be had with that to make sure their nutrition is adequate, not just during treatment, pre-treatment, and post-treatment, and that makes a big deal of difference.
Yeah.
Okay, now this is a very interesting question. Is it necessary to do mastectomy for breast cancer? Not at all, not at all. Breast conservation is the norm these days. It's not at all necessary to do a mastectomy.
Thank you so much. So, doctor, I think link
Is there a
between
link
gynecological.
between gynecological? Yes, it can be. The BRCA gene is one of those where if you have one or two of those genes, one or two, you have an increased risk of breast and ovarian cancers, and the other one you have breast and uterine cancers. They can go hand in hand.
Thank you so much. So I know lots of questions will be coming on. So this is actually more on creating awareness, and especially as you said that early detection is really important to treat a patient, and especially we will be more focused on our lifestyle, food habit, nutrition, and Also, yeah, the options are there for advanced treatment, but before we need to focus on our health every day. We'll have to, I mean, every month at least we'll have to check our breast so that this deadliest disease never hurts us. And our families matters, so be careful, everyone. Thank you, Dr. Kritika, for your very important discussion. Uh, in future, we will do more session on different cancers just to aware our audiences. Thank you, everyone. Thanks for watching.
Thanks very
Uh,
much. Thank you very much for having me. It's a
Thank
pleasure.
you. Uh,
Thanks.
so, if you have any queries, please knock our page IMIC, and we will try to answer your questions and queries. And thank you for joining us, everyone. Take care.
Thanks very much. Bye. Have a good
Take care.
day.
Cancer can strike anyone, anywhere and at any age. In India, there are close to 1 million cases every year. Every known type of cancer involves an uncontrolled growth of malignant or cancer cells in a particular area of the human body. There is a need for accessible world-class cancer care with the best possible technology and expertise. Bangalore was the first destination for this. HCG was launched in 2006 and since then has grown to become India's only dedicated cancer care network. HCG's comprehensive cancer care network is known as a Center for Innovation and Advanced Technology. HCG has a long list of achievements and firsts that has transformed cancer care in India. Asia's first bloodless bone marrow transplant. India's first computer-assisted tumor navigation surgery, CATS. India's first hospital to introduce flattening-free filter, FFF mode technology to treat a patient. Asia's first center to have treated a patient with 3D radio-guided surgery, known as Surgikai. India's first center to introduce biological reconstruction to treat bone cancer. Today we touch the lives of many around the world. And what puts us ahead of others is accessibility. Each of our centers are known for the many benchmarks they set in the world of healthcare. HCG Bangalore, the first privately owned comprehensive cancer care center in Karnataka, is acquired by HCG. First private center in the country to introduce cyclotron and PET-CT technologies. HCG Delhi, first center to introduce IGRT technology to North India. HCG Nasik, first private comprehensive cancer care center in northern Maharashtra. HCG Ranchi, first comprehensive cancer care center in Jharkhand. HCG Hubli, first center in North Karnataka to introduce IGRT technology. HCG Vijayawada, the first comprehensive cancer care center in coastal Andhra Pradesh. HCG Bangalore, one of the first centers to introduce cyberknife technology to cancer care. HCG Ahmedabad, first privately owned comprehensive cancer care center in Gujarat. First center in India to introduce TrueBeam technology. HCG Chennai, first center to use the revolutionary FFF technology to treat a patient. HCG Cuttack, first comprehensive radiation oncology center in Odisha. HCG Mumbai, first comprehensive cancer care center of HCG in Mumbai in partnership with B&H, which will have the first advanced and versatile radiation therapy center. HCG MSR Bangalore. Today we are proud to introduce a new cancer fighting technology for the first time in India with the launch of Agility Synergy at HCG MSR Cancer Center. The HCG MSR Cancer Center is a partnership between two well-known medical institutions, HCG and the MS Ramaya Medical Group. Today, with the addition of Agility Synergy, HCG has set a new benchmark in the field of cancer care. With 475 oncologists and a network spanning 27 centers globally, HCG provides hope to countless patients every year. HCG, specialist in cancer care.